Okay.
So, yeah.
Pete James, how are you?
I'm good.
Oh,
Yeah,
wait,
we're done.
watch
Oh, yeah,
out.
you hold-
Can you
okay.
just
Oh,
like...
right.
Oh, yeah. We got the
do-
mic. Got the mic.
Okay.
Cool. Yeah, we're good.
Yeah.
We're good.
I thought
Yeah.
you guys were podcasting.
Yeah, we're
So this is my first time. Yeah.
Okay, let's get serious.
Let's get serious. Okay.
It's not what I signed up for.
Okay.
Key takeaways from health. Where are your minds at the moment in terms of healthcare? I mean, you're from the UK, Pete, you're from Australia. How would you compare, what you hear there to what you hear here? And basically how does the content that was presented here reflect to the UK market? Anything that you can think of. Did you go first? Because you did like...
Yeah, just to warm us up.
teaser.
Warm us up. I guess the key conversations that are happening back home in Australia at the moment all revolve around interoperability and a lot focusing in on the system about utilising the fire standards. So it's been refreshing I know that's been a topic that's been discussed here, but a lot of the topics that I've heard here at Health Europe have been more so around the regulatory side of the digital therapeutics piece. Great to see a lot of focus on women's health and of course artificial intelligence and generative AI. I've noticed, and this is me thinking and talking at the same time, which is dangerous, but because sometimes
Welcome
I don't
to
think when I talk.
podcasting.
Yeah. But we spend so much effort and time and attention on this conversation about interoperability in Australia that sometimes it feels like if we just make it all the data connect, then like we'll wash our hands and all the problems
Everything
are
will be
sorted.
fine.
I would like us to focus more on once we've done that, or even can we start doing some of it now rather than spinning the wheels a lot, just focusing on the foundation, which is important, yes, but there's more we can be doing. So that's my blah.
John Halamka likes to say, there's no CIO that's going to wake up and say, give me some AI, please. And basically, generative AI was kind of the topic that you could hear from every single stage. So, James, what's your reflection on where UK is at the moment and anything that you heard here? Did any of the innovation that you've seen here especially inspired you, or you thought it was interesting, given the NHS, like 8 million people in the NHS are currently waiting for hospital treatments. At the same time, there's a lot of virtual wards. I think it's like 10,000 people a month are treated on virtual wards. Did you see anything that kind of caught your attention in that sense?
Yeah, I've just had my thinking challenged a little bit. There's one panel that comes to mind. I was hanging out at the women's health stage, and there was a panel on healthcare for LGBTQ people. And the panelists were talking, there was investors, there was people with startups on there, and someone was actually explaining just how and why the notion of just thinking about healthcare for LGBTQ people should not be just the same as for everyone. It's actually not a great mindset to just think, well, why can't we just think about it the same as for everyone? The explanation was that there's a unique collection of conditions that they might suffer from, both physical health and mental health, and by actually clinicians that become well versed in that type of healthcare, they can spot those things more, they can catch those things in a more preventative way, they can be more proactive. It's just something that I hadn't really considered beforehand. It challenged my thinking to think like, well, where else might I not be thinking that we should be adding a specific type of healthcare or centralising healthcare around certain topics or conditions or types of people. And yeah, it was just things like that that I've spotted on panels.
Well, speaking of diversity, Pete, do you have any comments to add? I mean, Australia has minorities that have different challenges when it comes to access to healthcare. I think one thing that stood out to me was that I want us to talk more about gender-based medicine, because we put a lot of focus on women's health, but at the same time, when men and women complain for the same things, men get diagnosed with stress, women get diagnosed with depression. So the same way that cardiovascular diseases present themselves differently in women than men, and we don't really quite know enough about women because they've never been studied. We don't know enough about how to properly diagnose men with depression and other sorts of conditions. And this basically goes back to what you said also. It goes further down to the LGBTQ community, and that's basically how medicine keeps evolving. It's a specialty, and then you've got subspecialties. Yeah. So I guess that's just one niche deeper that we are going into?
I mean, from my side, you asked about in Australia particularly, we've got a very big geographically a very large country, but we all kind of live on the outsides of it because it's too hot in the middle to live there. So remote monitoring and telehealth and all those things are important because typically those that live in more rural and remote locations might be of communities of need, might be Aboriginal and Torres Strait Islanders, might be in those requiring care and disabilities. Infrastructure is really important to be able to have those services. That's quite a common thing on our side. Interesting point you raised around the women's health in particular. One of the conversations that I had here on the forum stage for The Beat, because I'm Pete from The Beat, which is a podcast you can listen to from the conversations I've had. I'm a bit brain fried here at the end of it. Yeah, plug it. The conversation did touch on that. It feels like an insurmountable challenge to your example about how it feels like a cultural, it's a pervasive issue in terms of the challenges that women face in healthcare and everything. If you want to make change in that space, how do you even start? Because it's overwhelming. So building a community around that, rallying organisations and taking particular instances to allowing people to see examples of change and then build those examples. So it's a hard thing to do, but if we can rally behind it and kind of build that awareness and then get that buy-in to do the next step, then hopefully that's a good step.
That's where it starts, awareness. Any final thoughts?
We talked about communities a lot on my panel as well. I think
you had a panel?
I had a panel.
Really?
I had a panel.
What
Can you
was it
believe it?
about?
Can you believe it? They stuck me on a panel. Can you believe it?
And you moderated
I was
it?
moderating the panel,
Oh
so
my
I wasn't
God.
actually answering any questions, so I was only asking them, right? But yeah, we talked a lot about communities. On our panel, we talked about social media being a community as well, which I think, again, that's why this sort of thing's nice. Like, we're building communities around everything that we do and the people in the comment sections and all that kind of thing. All the learning that we can do together in between these events now is just made so much better with social media. And I guess on the panel, we were talking about it more from like a health conditions perspective. Patients are being creators now, clinicians are being creators now, and everyone that follows them, they're getting information, they're sharing information. So I think community's a wonderful word to be leaning into now because we've seen the death of a lot of communities.
Yeah.
And I think in the world and in life, we feel far less connected to each other. So I'm enjoying the fact that we can talk about social media in a more positive way. I think community is the big win that we can get the more that social media stuff matures as well.
I like the community part. I like social media part a bit less because there's so much mental health and other issues connected to it that we're finally starting to see regulation, especially in the US, about how and who should be able to use social media, especially in the younger population, in children.
Yeah.
Thank you both.